It's so funny how fellow women out there badmouth women that gave birth through cesarean section. They feel a woman who gave birth through cesarean section is less of a woman. Do they really know what cesarean section is all about? Do you really know what cesarean section is all about as a man? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you cesarean section. That's what I'm going to be discussing. I'm going to be telling you why a woman should carry out cesarean section, why it's important. Not all women that are indicated to carry out cesarean section. And I'm also going to be talking about the complications that are likely going to arrive when a woman has cesarean section. But before we go into details in today's class, if you are new on our YouTube channel, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. Like I earlier said, today I'm going to be talking about cesarean section. What cesarean section is all about. Let me tell you something. Cesarean section, vaginal delivery, as far you and your baby, they are fine. That is what matters. As far you are okay after delivery, your baby is fine. That's what matters. You did cesarean section, you did normal vaginal delivery. As far you are okay, that is what matters. That doesn't make you less of a woman because you did cesarean section. That doesn't make you a powerless woman because you did cesarean section. So what is this really cesarean section? What is the surgery that we are talking about? Cesarean section is an operation done in which a cut is made in the tummy of a woman. That's the stomach. That's stomach as we normally call it. It's not stomach, the tummy. That's the abdominal region. And the baby is brought out. So a cesarean section might be elective or emergency. Elective in the sense that it is planned. It is planned that, at 39 weeks, we are going to take the baby out. At 39 weeks, we are going to deliver the baby through cesarean section. It's already planned. The woman already knows that at 39 weeks, that's when she's going to deliver her baby. It could be emergency as a result of one or two reasons, as a result of one or two conditions. The baby is going into fetal distress, something is happening to the mother cannot push, something happened. They were like, emergency cesarean section, let's bring the baby to ensure that the baby and the mother is alive. When you are in a situation and your doctor is giving you an option for a cesarean section, he has told you the risks involved and everything involved. If that, for your doctor to tell you that, it simply means that that's the best way to ensure that your baby and yourself are fine. But there are a lot of indications that will make your doctor suggest cesarean section. I actually documented it here. I don't want to forget any. Like, while the doctor will tell you, okay, can you try cesarean section because this and this might happen. First one I have to share with you is baby in the breech position. Yes, some breech position babies can be delivered, but when the doctor find out that they cannot maneuver it, they cannot, the position does not allow them to easily bring the baby out, that might require emergency surgery to get the baby out. So the position of the baby matters if a surgery will be needed or not. Then the second one I wrote here is low-lying placenta, which is known as placenta previa, in which the placenta might be covering the cervix, that's the opening of the womb. So if the placenta is covering the opening of the womb, is covering this, where will the baby pass? So the doctor will advise you, it's advisable you go for a cesarean section to easily remove the baby so that you and the baby will be fine. So if a woman have placenta previa or even preeclampsia, they might indicate surgery for them. Then the other one I have here is pregnancy-related high blood pressure. Like I earlier said, preeclampsia. They might indicate what? Cesarean section. Then the other one, certain infections such as genital herpes and also poorly treated HIV, human immunodeficiency virus. Generally, back during my internship, women with HIV that are not properly treated, we advise them, please and please do a cesarean section so that you don't transfer this HIV from yourself to the baby during the course of delivery. It is safer to actually reduce mother to child transfer during delivery. So they might ask you to go for a cesarean section. Then the other one I have here is that your baby is not getting enough oxygen. oxygen. When they find out that your baby's heart rate is decreasing, your baby is not getting enough oxygen, your baby's heart rate is decreasing, they might tell you, oh, let's quickly bring the baby out through Caesarean section. And another one I wrote here is labor not progressing. For example, your labor started long ago, your water has ruptured long ago, but yet it's not dilating, still remaining in 2 cm, still remaining 4 cm. After 48 hours, the water broke, a lot of things happened, but yet the labor is not going further. It's just where it is. The doctor might give you the suggestion of going for a Caesarean section. Then the other one I have here is vaginal bleeding. If you are having vaginal bleeding, the doctor might give you like an option for Caesarean section depending on what is actually causing the vaginal bleeding. Then the other one is baby in distress, is similar with the reduced fetal heart rate I just explained. Then baby is too big, especially for women that are diabetic, that they give birth to too big babies. They have gestational diabetes, so their babies are very big compared to the opening of the cervix and their pelvic region. So the doctor might like, oh, it's advisable you do a Caesarean section to make it easy, because the baby will not be able to pass through easily, and that might result in a tear or something worse. Then the other one I have to share with you is reduced fetal heart rate. I've already said that. I think that's all that I documented here. There might be a lot of other reasons why your doctor might recommend Caesarean section. Please, this is just an educational video, but your doctor is in a better position to tell you, oh, let's do a Caesarean section. But most women sometimes these days just recommend that they do a Caesarean section because they don't just want to go through the stress of pushing the baby. They just want, oh, let me just get the Caesarean section. At least I'll just close my eyes, the baby will come out, and I wake up and I see my baby. So some women will they want it. So if a woman wants it, the doctor might just explain the complications that are likely going to arrive when you do Caesarean section. Like, okay, do you still want to go ahead with it? Again, whatsoever you are going to do, normally whatsoever the doctor is going to do, the doctor is expected to tell you the side effects of a drug is going to give you. It's going to tell you anything the doctor is doing generally. It's supposed to tell you the side effect, the complication of an operation, different things that are going to happen as a result of one or two things. So the doctor is likely going to be telling you, but you are still going to say, okay, I insist, I want to go. It's up to you. But there are complications associated with Caesarean section. The first one I have to share with you is infection on the wound. There could be infection if not properly cleaned, if it's not done in a sterile feed. If it's not done in a well sterile feed, there could be infection of the wound. There could be infection of the womb lining. Then the other one I have here, there could be blood clots. There could be excessive bleeding. Excessive bleeding might result as a result of Caesarean section. There could be damage to nearby organs around. There could be damage to nearby structures. You understand? Nearby buildings. There might be damage to nearby buildings if care is not taken. And also, there could accidentally cut the baby. But these complications are rare. I hardly see it because I believe for you to be a doctor, most of them are trained. But these are just complications that might pop up. Especially infection and bleeding, they might pop up. But since our doctors are trained, they know what they are doing, they might reduce the sepsis and you just go home easily. After Caesarean section, it might take 3 to 5 days. You might stay in your hospital for 3 to 5 days. But after normal delivery, you can go home within a day. But Caesarean section, they have to monitor you closely to know, okay, if you are physically fit to go back home. And also for that particular woman that asks, does Caesarean section affect fertility? No. Except during the process of carrying out the operation, something happened to the womb, something happened to the nearby structures of the female reproductive organ. But generally, Caesarean section just involves removing the baby. It doesn't necessarily cause future infertility, no. Except damage was done as a result of the complications arise as a result of the Caesarean section. But generally, Caesarean section is not necessarily a cause of infertility. Yes. And also somebody asks, after Caesarean section, does it mean I'm going to continuously give birth with Caesarean section? Like back then in my internship, it happens. Most women that started giving birth with Caesarean section, they continuously use Caesarean section. But in the recent, first Caesarean section does not mean that throughout you continuously use Caesarean section. There might be normal vaginal delivery, but they will have to monitor you properly. They will have to monitor you properly. They will have to do your checkup. But the doctor is still in a better position to tell you, oh, do you think you need CS? This and this might happen. They will still assess the risks, factors that are likely going to put you in that same position. So that's all I have to share. Thank you very much for staying tuned. Thank you very much for watching this video. I hope the woman that asked the question has been answered. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. All my returning subscribers, this is Nurse Messi saying thank you. Bye, and see you in our next video.